Welcome back, guys. Today we are going to see how we can manage hyperthermia using nursing process. We are going to formulate our care plan. Hyperthermia is high body temperature. So in this nursing diagnosis says hyperthermia related to saturation of toxin released by malaria parasite in the blood, as evidenced by thermometer reading of 40 degrees Celsius and the love BS blood slide showing greater than 20 MPs. We are going to start with assessment. In assessment, we have subjective data. And subjective data we are going to get from the patient. In the subjective data, it is under assessment. Now, we're going to assess. We are going to ask the name. Maybe the name is called Okoli, and then the age. The age could be like 2 years. So we're asking the attendant because this one is the child. Then we ask for location where the person is from. Also enter next of kin. So all the data that you have to put under subjective, you list them down. We have objective data. This is the data that for you measure from the patient. So first, from our thing here, hyperthermia, and this one we will write observation like temperature 40, pulse maybe 140 beats per minute, respiratory rate it can be like 40 or 50, SpO2 and like 90, and then what next under objective data, anything that you can measure, you write them down. So this one is our objective and subjective data. We are supposed to come to nursing diagnosis, but it has already been given to us. Then here we can come to planning now. In planning, we have two parts. We have our plan here to normalize the body temperature, and then in under plan we have what we call short term and long term. Short term plan or goal, and then we can say in our short term we have to reduce the body temperature by 3 within 4 hours. This is our short term. And then we have long term. We said this is what we are supposed to, what we want to achieve in long term, to maintain the body temperature to normal. So in long term, what you will achieve in long term run, and then short term, what you have to do to relieve the patient's condition very fast, the life-threatening condition. In temperature, if temperature is there, a patient is prone to convulsion or fainting. simple term. Then we come to implementation. Create report the rationale is to allay anxiety within 10 minutes. Now, in this short term, we will now give our rectal paracetamol. Can be 250 milligram as prescribed by doctor. This one to suppress the it center in the brain within 1 hour. So another one, we are going to do tepid sponging. Tepid sponging to allow it lost through evaporation within 3 hours. Then what we are going to do, we are going to open all the window to allow air escape, to allow cool air in, to allow air escape, and then we are going to shun within, let's say, 4 hours. So what we are going to do again is we are going to remove extra clothes from the baby. So this one to prevent overeating the baby. So this one will be within removing clothes can take only 10 minutes. So in a long-term goal, we are going to continue with the medication. We are going to administer prescribed drugs, e.g. antimalarials, and antipyretics. This one is to eradicate the parasite and reduce the temperature. Then will be within 4 days. So this is our long-term goal. All these ones were short-term. And then our rationale, we have seen all here. So we go to evaluation. Evaluation is looking at your plan, what you have done, if it has all work. So here can come and say anxiety allayed within 4 minutes. You know, mothers with the baby, if they can accept things very fast, so they will not give you hard time. Then rectal paracetamol was given within 10 minutes. Total PCM paracetamol was given within 5 minutes. And then tepid sponging was done. Tepid sponging was done within 1 hour. And then window was open within 2 hours. And then extra clothes was removed within 2 minutes. Extra clothes was removed within 2 minutes. Then for the medication is still going. So in our evaluation, at the last we control the temperature, and the temperature has reduced so by 1. So after that you continue all the process again until you achieve the goal of 3 degrees Celsius. So that is how we can formulate a nursing care plan for hyperthermia, or you can even give others. We can continue, we will formulate for each and every nursing diagnosis which I've come across, for DIB, for anxiety, knowledge deficit. So that is all. Thank you for watching, and see you in the next one.